Welcome, I'm Tamara Smith. This is Communications 101, my informative speech on pancreatic cancer. Imagine that you haven't felt well for several weeks, even months. You've had abdominal pain, you've lost your appetite, you've lost a tremendous amount of weight. The doctor's been treating you for an ulcer, however, you haven't had any relief. So he runs a series of tests, including a CAT scan and a biopsy, and he comes back with a diagnosis. You have pancreatic cancer and only 6 months to live. This happened to my father. He lived 1 month after his diagnosis. And since his diagnosis, I've hoped and prayed for a cure for pancreatic cancer, or even advances in treatment. However, there haven't been any. Francis Nugent and Keith Stewart, MD of Medicine.net, describe pancreatic cancer as a silent killer because before there are symptoms, usually the cancer has spread. Once the cancer is spread, it's virtually impossible to treat pancreatic cancer. Black's Medical Dictionary defines the pancreas as a large gland located above the stomach. It has two functions. The first function is digestive. It secretes pancreatic fluid into the small intestine, which aids in digestion of fatty foods and starches. Its second function, which is totally unrelated to the first, secretes insulin into the bloodstream by scatterings of glands throughout the pancreas. The determining factor as to how a patient is going to be treated who has pancreatic cancer is whether or not the cancer has spread. Because once the cancer enters the lymphatic system, it spreads rather quickly, usually to the liver first. This is what happened to my father. Dr. Duncan Spalding, professor of surgery at Imperial College in London, who is a pancreas specialist, prescribes that surgery is the only sure cure for pancreatic cancer. Chemotherapy and radiation can also be used, but these are mostly used to keep the cancer from spreading and not necessarily to eradicate it. Once a patient decides whether or not they're going to have treatment, if they decide not to have treatment, they can live 3 to 6 months. If a patient decides to have surgery along with the chemotherapy, they can live up to 23 months. Survival rate beyond 5 years is less than 5% pancreatic cancer patients. It's rare to contract pancreatic cancer before age 45. Usually, patients are between the ages of 60 and 80 who have pancreatic cancer, and it is more common in men than it is women. There are no known causes. However, cigarette smoking and diets high in fat have been linked to possible causes, as well as genetic factors and diabetes. So as you can see, this is a devastating diagnosis for a patient and their family. So what can we do as the body of Christ to help them during this difficult time? As a church family, we can develop a cancer support ministry. This would involve teams for specific needs for cancer patients. Dave Scarf of Cancer Hope Southbrook Community Church in Centerville, who is a cancer survivor, described one aspect of a prayer ministry under their Cancer Hope ministry was to wear a beeper. These beepers are worn when a cancer patient goes for treatments, and every time someone prays for them, they page the patient. He receives a beep. He said during his treatments he would receive beep after beep after beep, and he said it was so encouraging for him to know that he was being bathed in prayer during that time. Another aspect of this ministry could be providing meals, housework, yard work, and transportation to and from appointments or treatments. Financial aid could also be provided for patients for medical bills or transportation expenses should the patient have to travel for treatment or to see a physician. And this could be done through fundraising. An elder at our church recently said he had a vision of our church being a cancer-free church. It can be free of the weight that cancer places on patients and their families. And we can lift this weight by lifting them up in prayer and seeing that their needs are met and that they're being ministered to, so that they can concentrate on healing, and also so that they can have the hope that they can be healed. And we can also give them the hope of Jesus, that should they not be healed in this lifetime, that they will be healed in the next life for eternity. Genesis 50:20 tells us, "As for you, you meant evil against me, but God meant to bring good, so that many people should be kept alive." Cancer was brought into mankind by evil. However, by educating ourselves and coming together as the body of Christ, we can bring about good for what Satan intended for evil. Thank you.